My name is Sushi.
It's Champa.
Quentin.
Melissa. Emily.
And I suffer from depression.
And I suffer from depression.
And I live with depression. Depression is a mental health condition that affects 7.1% of the U.S. adult population, or 17.3 million individuals. Antidepressants are a leading treatment, many of which are available. They work by changing the production of or reducing the reuptake of three main neurotransmitters, including serotonin, whose role is to regulate mood, appetite, and sleep, norepinephrine, which influences alertness and motor function, and dopamine, which plays a central role in decision-making, motivation, and the signaling of pleasure and reward. There are 5 major classes of antidepressants. Selective serotonin reuptake inhibitors, SSRIs, work to prevent the reabsorption of serotonin in the body. SSRIs are a newer class of antidepressants first developed during the 1970s and include Prozac, Zoloft, and Lexapro. SSRIs tend to have fewer side effects than older antidepressants, but are still known to cause nausea, insomnia, nervousness, tremors, and sexual dysfunction. Serotonin and norepinephrine reuptake inhibitors, SNRIs, inhibit the reuptake of both norepinephrine and serotonin. The first SNRI was FDA approved in December of 1993. Common side effects of SNRIs include nausea, drowsiness, and fatigue. Tricyclic antidepressants, TCAs, work similarly to reuptake inhibitors in that they block the absorption of serotonin and norepinephrine in nerve cells, but also act on acetylcholine, which help regulate the movement of skeletal muscles. Monoamine oxidase inhibitors, MAOIs, inhibit the action of an enzyme called monoamine oxidase, whose role is to break down monoamines. In doing so, more neurotransmitters are available for use in mood regulation. MAOIs are less commonly used due to the potentially severe reactions with foods high in tyramine, causing an increase in blood pressure. Antidepressants are more of a miscellaneous category. They do not fit into any of the others and affect serotonin, norepinephrine, and dopamine levels in unique ways. There are many antidepressants available, but is medication the right answer? And if it is, who should be the one prescribing it?
Prescription medications like Zoloft and Prozac are effective ways to treat depression and are the go-to options for physicians. Depression is caused by an imbalance of chemicals like serotonin, which in turn affects certain nerve connections. Antidepressants work to increase the availability of these chemicals. The goal in the first few months of taking antidepressants is to relieve the symptoms and, if possible, make the depression go away. Once that is accomplished, the treatment is continued for at least 4 to 9 more months. This continuation therapy works to stop the symptoms from coming back. Ultimately, the length of treatment depends on how the symptoms develop over time and whether there is an increased risk of relapse. Some people take antidepressants for several years. Regular appointments with a physician are important during treatment. With the doctor, you can talk about whether your symptoms have improved and whether there are any side effects. The dose will be adjusted if necessary. By no means should you increase or reduce the dose on your own.
Whenever you're ready.
My name is Sushi and I suffer from depression. It's something that I felt ashamed of and kept to myself for a really long time. I mean, it's not like people just say to their friends, "Yo, I've been really sad lately," but it affects me all the time. It's not that I have suicidal thoughts, just most of the time I feel like there's not a lot worth living for. But it's a lot more than just feeling sad. Getting out of bed in the morning can be my biggest challenge of the day. I feel so tired all the time, like I have no energy. I've been in counseling for a little over a year now, but I still feel down most of the time, and my therapist and I have been talking about seeing a psychiatrist to take the next step with medication. I know a couple people on antidepressants and I've heard mixed reviews. I've heard it can make people emotionless or worsen the depression, and it causes weight gain, so I'm scared. But I also don't want to live with depression for the rest of my life.
I personally haven't had any prior experience with depression, but I don't see how any change in my daughter's behavior since she's been claiming to have depression. So I have a hard time believing this is really for her. Medication is something for people with psychotic disorders, like schizophrenia. I think she might be stressed from school, but I don't think labeling herself with something like that and being put on drugs is a great idea. Labels damage people's lives. I want her to be happy and healthy, but I also worry about what medication could mean for her and what other people would think of her. Is she going to be made fun of? Will it affect her ability in receiving a job if she's labeled? If we absolutely have to do this, I don't want her to go to a mental hospital or anything that serious. I think we can just see the doctor for now because we know her better.
I've been seeing a therapist since I was an adolescent, but I would never put myself on medication. It might be right for some people in very severe cases, but usually changing your diet can greatly improve depression. With my empirical knowledge and what's been seen in multiple studies, going gluten-free can actually cure depression. Serotonin is produced in the intestines, and when people eat gluten, and I might say, a great number of people have gluten sensitivities these days, the intestines attack themselves and they don't produce enough serotonin, leaving many people depressed. I also don't believe in taking drugs from big companies that use studies they fund as evidence for their efficiency.
Cognitive behavioral therapy is what most people are referring to when they talk about counseling or therapy. CBT is incredibly important if someone is suffering from mental health issues, and it should be the primary treatment. Antidepressants are like a life jacket. They sometimes are vital to a patient's survival and well-being. They keep them from drowning, but they can't teach somebody how to swim. Coping mechanisms need to be learned in order to have that ability to swim. I support medication in many situations, but they aren't ideal with all their side effects and shouldn't be used as a long-term solution unless absolutely necessary, which is the case for some people with serotonin deficiencies. Depression needs to be treated with different methods in order to make treatment effective as possible. A person who is suffering needs therapy, exercise, healthy eating, and in many cases, medication.
I suffer from depression, but I have never been formally diagnosed. My insurance doesn't cover therapy and psychiatric care is really expensive, and there is no one in the area. So I have an appointment set up with one of my doctors. I want the best care possible, but it's difficult because of finance.
I suffer from depression. I was diagnosed because I feel down most of the time. My family doctor prescribed me Prozac that I've been taking for a year now. It's easy, close, and I don't have to feel embarrassed about going to a mental hospital.
I went to medical school at Michigan State, and I've learned all aspects of medicine. So even though I'm not a specialist, I am qualified to prescribe antidepressants. I don't have all the same qualifications as a psychiatrist, and there are many things I cannot prescribe. But depression is very common these days, and I have seen a lot of it. That aside, some people can't afford to see a specialist, and there aren't many in our area, so it's easy for my patients just to have that conversation with me, and we can find solutions together. This will give everyone in my community a chance of living to their fullest potential, rather than having to sacrifice their happiness from the feelings that overpower their thoughts. Taking the medication can give people a chance of living a regular life.
Hi, Quentin.
Hi.
Hi.
How are you?
Good. How about you? All right. Okay. Let me check here. So you have now been on Prozac for 6 months, correct?
Yes.
And have you been feeling okay? How have you been feeling recently?
I've been okay. I've just been feeling really spacey, and as of recent, I've been feeling kind of numb.
Well, if you've been having these feelings recently, I would consider actually switching medication because it doesn't seem like Prozac is actually working. According to your symptoms, Zoloft. If a patient comes to me and I can't fix their issues, and there are no psychiatrists in the area, then I am not a good doctor if I can't help them.
I've been diagnosed with depression and generalized anxiety disorder, and I've been taking the antidepressant Lexapro for about 4 months now. I've recently increased my dosage from 10 milligrams, which was a medium-sized dose, to 20 milligrams. I just felt like I wasn't benefiting from the 10 milligrams during the first 3 months of my usage, so I spoke with my psychiatrist and we agreed 20 milligrams would be better. I have also been seeing a therapist for the past year and a half that I was connected to through my primary care doctor when I first mentioned my issues with depression and anxiety. She and I worked together to find healthy coping mechanisms to deal with my anxiety and ways to take care of my brain and my body. I think medication is a good solution, and it all depends on the person. I don't think I want to be on medication for my whole life, and that can also be different from person to person. But medication cannot be the sole thing that helps you. I think it is a combination of healthy coping skills and self-care with the medication that will help me and other people like me improve their mental health and take care of themselves.
Medication is the last resort for patients struggling with mental health in most cases. Therapy is our go-to, and nothing can replace having coping skills and a healthy lifestyle for anyone. There are exceptions for people who have chronic neurotransmitter deficiencies, but we always turn to medication last. It can be a very helpful tool for a lot of people though. I like to think about it like a springboard. We can't replace cognitive behavioral therapy, but sometimes patients can't truly engage because their depression is severe enough that they aren't able to apply the strategies that we try to develop in their lives. Medication can help get these individuals where they need to be for this to occur, and then they're able to manage their depression without dependency on medication. For these people, finding the right medication can be a trial and error situation that sometimes takes time to find what's right. This can be frustrating, but everybody's body responds differently, so we have to try different classes and vary their dosage. Antidepressants are one of the most widely prescribed drugs, which is really unfortunate because it's not by mental health specialists. If you were having problems with your heart, would you go see a primary care physician or a cardiologist? While family doctors have some training, they don't have the same expertise or experience that psychologists and psychiatrists possess. Medication shouldn't be handed out like candy, and people who are on it should be very closely monitored, which is absent for individuals who see these family doctors for depression.
I'm worried about Sushi. She watches a lot of TV shows like 13 Reasons Why or Euphoria, where depression is romanticized, and I think it sucks her into it. Plus, depression isn't black and white, and medicine isn't going to just fix her issues. If she has depression, medicine is only going to mask her symptoms. There haven't been any studies unbiasedly funded that proves medication works. I just want to make sure that she's okay and getting to the roots of her issues.
I don't suffer from depression, and I don't have any family or friends that do. It's definitely a big issue though, and I think it's wonderful that the stigma is breaking down and this issue is coming to light. I advocate for medication because people that have chemical deficiencies in their brains deserve to be able to live regular lives. It sucks that some people can't afford to see psychiatrists, but a doctor is better than nothing.